Norovirus is basically a virus which goes and attacks your gastrointestinal system. It will go and it will bind with some cells in the gastrointestinal system and cause an infection.
So, as the country is dealing with coronavirus cases on a daily basis, though the number has come down, another virus known as Norovirus has come into existence, and we can now see that the cases are on a rise. Although there is very less awareness about the cases of Norovirus and exactly what it is. So, today I have with me Dr. Prithu from Fortis Hospital joining with me on India.com and the Health Site. Welcome, Dr. Prithu.
Thank you very much.
So, doctor, as we all know that coronavirus is still on its way, and we're still dealing with this pandemic. And now we can see that a norovirus cases have come in, and there is a very less awareness as to what exactly norovirus is. So, first of all, I would want you to give just a brief description to our viewers as to what norovirus is and how is it similar to coronavirus, or it's a completely different set of a family.
As we all know, coronavirus is there and it's still out there. It's coming down, but now in news, norovirus is more circulating. So to be to be clear, in fact, norovirus is not something which is new. Noroviruses have been there for multiple decades, if not centuries, and these are normally viruses which have been infecting us quite frequently. It's just that no one actually goes forwards and investigates these viruses because most of these diseases which are caused by these noroviruses are something which are mild. So norovirus is basically a virus which goes and attacks your gastrointestinal system. It will go and it will bind with some cells in the gastrointestinal system and cause an infection. So this virus is basically food-borne, food and waterborne. So any infected food, drink, or even if the surface is contaminated on which you are eating food, like contaminated plates, spoons, or anything like that. If the virus is sticking on those plates, it can also go enter your digestive system and cause symptoms of norovirus. So as I said, norovirus is not something new which is there, but it is something which usually happens in clusters.
Right.
Like if one person is infected with norovirus, that person is active shedder of norovirus, like he or she will pass norovirus through their motions, and if proper hygienic care is not taken, they will spread it to their surrounding people. So
Right.
it is more of a concern now because clusters have been identified recently in Kerala, in which a cluster of people in the hostels were identified to have this norovirus, and they were tested for it and they came positive. So because it can spread, it is more of a concern. Otherwise, it's a virus which usually causes a gastrointestinal illness.
Right, doctor. So it is not related to coronavirus in any way. Is Can you clear?
No,
Yeah.
no. It is not related to coronavirus, though it shares one small feature, or like sometimes some particles of norovirus may get aerosolized, and sometimes there is a slight possibility that via the inhalational route,
Right.
norovirus can also go inside your body, but this mode of transmission is less as compared to the fecal-oral route, means via mouth,
Right.
whatever food or drink we have. So apart from this little small chance of getting it transmitted from breathing or droplets, otherwise there is no as such similarities or no correlation between the norovirus and the coronavirus.
Right, doctor. So, what are the basic symptoms of norovirus? If you could tell our viewers.
Right. So norovirus is also, is called as winter vomiting syndrome or winter vomiting disease.
Right.
It is basically a gastrointestinal disease which affects your stomach and intestines, and it causes stomach upset in the simplest way to put. You can have fever, vomiting, stomach pain, loose motions. These are the most common symptoms which you have, and because of the vomiting and loose motions, there is obviously fatigue and
Right.
tiredness which sets in. So these are the main symptoms of noroviral illnesses. Sometimes in some patients who are immunocompromised, like patients who are on some sort of immuno suppressing medicines like steroids, or patients who have received some transplants, or are under some treatment for some rheumatological disorders, or even infections like HIV. For them, this infection can be a little bit more severe, and the entire process of vomiting, diarrhea can be prolonged, and it can even cause some damage to the intestine and the intestinal villi. So usually in the immunocompetent host, it will not happen, but in certain sets of vulnerable people, these symptoms can happen.
Right, doctor. So if you can suggest a few tips as to what people can follow to prevent from this disease.
So the tips are simple. As I told, it's a food and waterborne disease. The most important thing is to have properly cooked food. Just mere heating of food or just warming of food is not enough nowadays. A lot of us have the
Right.
tendency of yeah, eating outside food, and it stays in the refrigerator. It's warmed just to make it hot, and then it's consumed. Even semi-cooked food is also preferred by some people. So just mere warming food is not enough. The food should be cooked ideally up to boiling temperature, if not at least should be cooked above 60 to 70 degrees Celsius, and then it should be consumed. While consuming any raw food, always there is a threat of this norovirus which can be there. So the best thing to do is try to avoid consumption of raw food just like that. Proper washing, if even if possible, in some sodium hypochlorite solution, can help in reducing these viruses. These are the food-based precautions. Water, obviously, in areas where you are having norovirus outbreaks, try to have water which is boiled and then
Right.
cooled and then consumed, because not necessarily always the claimed so-called UV filtration or RO filtration and everything can always get rid of it. Though I'm not an expert on that thing, but definitely a simple plain boiling water is 100% effective in killing these viruses. So always ensure a good water supply, clean water consumption. Third thing is, which I think is also very important, is making sure that your own hands are clean before you consume food,
Right.
because we touch multiple things across in our day-to-day life, and in the busy schedule we do not usually wash our hands that frequently. It's very important to understand that in the age of corona, where now
Right.
hand washing and liquid
Sanitizing.
hand sanitizers have been promoted very well. But the norovirus is an non-encapsulated virus, which means it doesn't have a capsule. And non-encapsulated viruses are something which are not easily destroyed by alcohol-based hand rubs. Alcohol-based hand rubs do help in reducing, but soap and water is definitely more effective against norovirus per se.
Right, doctor. So as I could understand as a layman, that for this norovirus, hygiene is the key factor. That you have to keep yourself extremely hygienic. You have to keep washing your hands, and even if you're not infected, you should keep your hands clean and sanitized, because coronavirus is already still there. And as far as other measures, other treatments, if you can just give a brief as to what a treatment they should follow up.
So most of the norovirus infections are also mild to moderate infections. Usually, a person after getting the illness or after getting the virus start showing symptoms after say 48 hours or so, and they will have the symptoms which we already discussed. So as I also told that there are no definitive antiviral medicines available. Majority of the treatment is supportive, which again
Right.
includes rest and plenty of fluids. You can have normal water or even electrol water, the WHO ORS solution waters to keep yourself hydrated. Most of the people who are immunocompetent people, it's a self-limiting disease which usually settles down within 4 to 5 days with good supportive care, especially maintaining good hydration.
Right.
That takes care of it per se.
Right.
Otherwise, there is no as such specific antiviral medicine in order to treat norovirus infections. If you have some other symptoms of vomiting, nausea, sometimes a little bit of fever, again supportive treatment for reducing those symptoms is all what we can do. So
Right, doctor.
apart from that, nothing else is there specific for norovirus infections. If some people do progress to a severe disease, then definitely hospital, they should be hospitalized and being based upon whatever severity they have and which ever organ system is involved, they should be treated accordingly.
Right, doctor. So, as you mentioned, that supportive care is the key, and you should increase the intake of, fluids a lot, because, it's a gastrointestinal thing. It keeps you weak. So, you have to stay hydrated. That is the key factor for getting one treated with norovirus. And thank you so much, doctor, for coming on the health site and India.com and clearing this myth that, norovirus and coronavirus are not related. They're completely two sets of other disease families and have other symptoms, and just one common thing is there which you've already explained. Thank you once again.